everyone. It's Dellann from the Brain Cancer Initiative. And I wanted to let you know why we're doing what we're calling our PCNSL online roundtable. So we know that there's a group of patients and their care partners who are living with this disease and who have asked for more resources. And they've asked for pharma and their healthcare providers to better understand what it's like to be a patient or a care partner for a patient who has been diagnosed with PCNSL. What we're really seeking are their unmet needs. And it's not just the time of diagnosis. They want resources and they want support all the way through the journey. What happened? What's your story?
But we did pick up 2 masses in your brain. I'm stunned. She's already got her iPad out and researching cancer groups, cancers.
You're not alone. There are so many people that are going through the same.
I know my aunt has like a small group in where she actually goes take her medication. But I feel like more could be done.
The PCNSL was kind of this weird, you don't fit in anywhere. It's like, I already don't fit in. And now like these cancer groups are like, but you don't fit here, right? Like that's why I started that Facebook group. So there's a Central Nervous System Lymphoma Facebook group. And I really started it because I felt I was alone.
What is it you wish your healthcare provider had told you or given to you when you were diagnosed?
I really didn't know what to expect at first until, it started happening, with the symptoms, some could just happen suddenly. You're not really expecting it.
One of the aspects I would say that I would love to have training on would be the aspects of medications. Needed, what is not needed, when it should be given. But I feel like giving me a background check on while these medications are being prescribed, so I understand why she's taking it.
One of the basic main symptoms is the fact that it affects your speech over time and trying to communicate with people.
I had so I had a stem cell transplant. That's what's kind of cured me, right? They kind of rushed me through the process, which I'm grateful for that I'm healthy. But I wish I would have froze my eggs, like to have more kids. I was 29.
I didn't really understand the diagnosis at first. I wish they had told me that, it's like a genetic disorder. I did not know it was actually like from my gene or something like that.
What is it you wish to say to them, or what is it that they need to know?
I didn't have time. My tumor was growing and there was no time to spare. And that's the scariest thing about having something that grows rapidly.
Maybe I could ask about, do you need to come up with a new medication?
I wish the pharma industry could to like improve access to treatments, increase funding for rare cancers.
I wish there will be more medication that work faster. You understand? Try and make sure that the person is not passing through a lot of pains.
I would want them to actually focus on the cure symptoms, that actually affects our daily lives. Saying that they should mind the side effects, because new treatments like this have side effects that have not even been tested. So I feel like it should be tested well before, you try it on, patients.
Every patient is different. Everyone responds to different medication differently. So I would actually ask the pharmaceutical industry to try as much as possible to ensure that they put this in mind. And I would also try to ensure that they are using as much natural supplements as possible. I think that the price for a few of the medications are quite on the high side. If a little bit of breaking down in price would actually really help a lot.
When you're in remission, the fact that you're not cured, if a pharmaceutical company could say, here's the recommended protocol, I would be all on board for following something like that.
So I was talking about the support that we got from the doctors and the nurses, and it really helped because it reached a point when my mom was going for the chemo, and there was some effects. She was feeling some pains, so we were able to talk to the doctors, and we got some medications for that. So I would say that the biggest support that we go from the medical team, like the doctors, the nurses, and sometimes, of course, I could personally go look for some information online, but I'll just say like some of the information online was discouraging. So I just decided not to do that. At that point, I was not aware about the patient Facebook groups. So if I was aware about that, maybe it could have helped a little bit about maybe learning from other patients and their experiences. But online, I'll say it's not an appropriate platform for you to get such information because some information may be discouraging. But maybe the groups, the patient support groups, can be can help a lot. So that was my journey. Yeah, thank you.
Thank you, Tim. And, some of the things you shared with me when we had an opportunity to talk earlier is you really wish the public knew about the symptoms for PCNSL, right?
Yeah.
So that people would have a better understanding of what it's like from a patient perspective, but also from a care partner perspective. And so I wrote down, you would like general public information on symptoms, as well as the public to know what the symptoms are for this particular disease in order for more understanding of this disease, correct?
Yes, like for instance, for my personally and our family, like for my mom, symptoms were not very serious, so she just still started experiencing some headaches. Sometimes she was feeling confused, and then it reached a point when she was having problems with her eyes, so she could not see some things properly. So it was like a red flag, but I thank God because it was diagnosed a bit early and she was able to get the medication that she needed. But if she was not diagnosed a bit early, maybe it would have been hard for her to get the treatment. So maybe knowing about the symptoms on where to go for the checkups or maybe something like that can be of much help because many of us don't know any symptoms. Sometimes you may be feeling some headaches, then you feel like it's a normal headache because you're tired or something, but maybe it's something serious. So they can document those symptoms, maybe make the community aware about the symptoms, then it can be of much help so that maybe people can go for the checkups and diagnosis a bit early before it's too late. Yeah, thank you.
Thank you. And the other thing that you shared with me many things, and they're all important. One of the things I want to talk about is, you wish the healthcare provider had perhaps referred you to a social worker or at least given you information on how, as a care partner, to expect this disease to affect you, right? Yeah. I mean, emotionally also.
Yeah.
Yeah, and some of the tools and some of those things that would help you as a care partner for PCNSL, right?
Yeah, because
Yeah.
sometimes we feel like we focus more on the patient and we forget about the caregivers or the care partners. Because so if you're caring for someone and you get affected also as a caregiver, so how do you help a caregiver? Because sometimes we focus more on the patient and sometimes the caregiver also suffers from maybe mental health problems, fatigue. Sometimes you may feel stressed because maybe your patient is not getting better. Yeah, so some tools for the caregivers, how to help them, how to navigate through the situation while caring for someone under medication. Yeah.
Thank you, Tim. We have a couple of comments in the chat, and so this is all related to this particular topic, right? Not only what kind of information did you receive from your healthcare provider at the time of PCNSL diagnosis, but what kind of information you would have liked to have provided. And I love this comment. I teach high school English. I 100% think we need a vocabulary list for this disease. Agree so much. Agree. I wish I and my mom were told she would be needing speech therapy after she was diagnosed. Does anyone want to talk a little more about that? that kind of information?
I lost my speech. Yeah, I had to get speech. I pretty much didn't have any speech. And so I went to rehab to get that back. And it all came back.
So, Lori, when you were diagnosed, did you not have speech then, or a little bit later you lost your speech?
I didn't have much at all.
Okay.
I had like a couple words, that's it. And then I had to go to like a rehab hospital.
Mm-hmm. And you got your speech back, obviously. So that's been.
I didn't have use of my right side of my body. Obviously, I had the craniotomy, and then I
bet
had
it was
too.
Yeah. Sorry to interrupt you. I apologize. I bet it was very scary losing your speech as well.
Yeah, it was hard.
And so you were sent to speech therapies, right?
Like an inpatient rehab. It was an inpatient rehab. And I was like, I was young. I was 53 when it happened. I know this one lady was a lot younger than me, and there's people here that were younger than me. But at the time, I was 53. And so I was angry, and I had to like use a wheelchair to get around, and I couldn't talk. And so
yeah, I understand. That would be very frustrating. Hey, Lori, on your screen or your phone, I'm not sure what you're on. It was wiggling a lot. It's perfect right now.
Okay, sorry.
Stay there.
Yeah.
Jordan, I see your hand. What would you like to share or ask or comment?
So the problem was my mom didn't get speech therapy until the next year after being diagnosed. So we didn't know she was going to have like speech problems over time. And after a year, we quickly realized at home that she couldn't speak well. So we went back to the hospital and we were told we needed speech therapy. So I really wish, if it was told earlier, like the week after diagnosis, or a month, probably going to be better, very for being like knowing that she's going to have problems with her speech. So it was a problem for her. She had to go to get speech therapy the year after being diagnosed. So I think it would be much better, having to like have that information at first.
Absolutely. I think that would have been very helpful. Agreed. Let's see here. Jamie, you had your hand up. May I read your comment? In the chat box, Jamie says, I wish I'd been made aware that agitation and aggression were likely because of the cancer and as side effects of some of the treatments. I see some people shaking their heads and as in, yes, that would have been helpful to have that kind of information. Jamie, do you want to take a moment to talk about that a little or add any more to that comment?
Sure. I will also tell you, I'm very sorry I have to drop off in a few minutes for an appointment for my daughter, but I just very much appreciate even being able to be here and meet all of you.
Thank you so much for being here. We will, for those of you who want to be connected, we will connect you. Just let Shreya at endbraincancer.org know you've been communicating with her to set up these different appointments. Let her know you're either in or out for being connected with the group today.
Okay. And also open to being poked about that, because one of my kids has been very ill and in and out of hospital for quite some time. So I'm consumed with that as well.
Okay, we'll poke you.
Thank you. Yeah. Again, part of this is the distance, the physical distance that I live in Boston. My mom was in Kansas City, but even still, I was, I talked to her every day. So hearing the agitation ramp up, and before she was ever diagnosed with anything, the dismissal with which she was met was just, it was unreal. And again, after the fact, when my mom was here with me and we were at Dana-Farber, the nurses on the call line were so good when I would call and say the agitation, and they would be like, they just were very affirming. So there was so much missed in the beginning, so much information that could have been given. And I'm a pretty high information person. I'm pretty much going to write everything down that they say in the doctor's office. And I can keep track of just every medication and dosing she ever had. I don't remember the name of my 4 kids. That's kind of how my brain worked during this whole process. But if I'd been told her kind of cancer and where it was would cause this spike in agitation and quite honestly, aggression. It just could have made access to some things a little different. We could have been a little bit more, well, gentle in her, and not me personally, but like just gentle in the way that people approached her. But just
More
been very,
more patient.
and letting her know that we know this is not you. So here's what I ended up saying to my children when we brought my mom to live with us so I could care for her. Again, this was during the beginning of COVID. So it was very intense, everything locked down, you know, and whatever. At the time, my youngest was 5. And I said to my kids, Grandma has a kind of cancer that affects her brain, and it's going to make her look and sound sometimes different, like you don't recognize her, because there's her grandma brain, which brings suitcases full of candies and toys, and paints your nails and sleeps on the floor with you slumber party style. And then there's the cancer brain, and that the cancer brain can get very angry all of a sudden. I wish somebody had said that to me in the beginning. I wish someone had said that to her when she was in a space where she could have received that, because I think it just could have made a difference in how she viewed her care and her responsiveness with some things when I wasn't in Kansas City with her, to sort of get the ball rolling.
Thank you, Jamie. Thank you. I completely agree. I see 2 people who have their hands up. Jordan, I think you had your hand up, and Dawn, I do see you and Neil have your hand up as well. Jordan, can you take the floor?
My hands were up the last conversation, so now my hands are not up.
So you're okay? Okay, thank you. Jordan, actually, hey, Jordan, can I share a little bit about your story really quick?
Okay. Yeah, sure.
So Jordan was diagnosed, and tell me if I have this correct. Jordan was diagnosed with PCNSL when he was 3 or 4 years old. It's been really interesting talking to Jordan because he has, of course, a patient perspective, but he also has a care partner perspective because his mom, you know, was his care partner. And he was able to share a lot of information with me about his mom, who absorbed, of course, all of the information because he was so little. And it was up to his mom to convey the information that had been given to her to him. And so I just wanted to thank you, Jordan, for sharing that information, you know, but you also said something really important, that you wish you had been told that for your case, that there could be a delay in speech, right? And there could be a delay in development and a delay in social skills, right? Isn't that what you shared with me? So
Yeah.
yeah, and you also said, you know, because you were so young when you were diagnosed, that you shared that you wish your healthcare providers, resources, etc., had been able to talk to you about how PCNSL would affect your life going forward. Correct?
Yes.
So thank you. I want to thank you for sharing that with me too. Those seem like very, very important opportunities for advocacy to get behind and start educating about, and maybe getting to our healthcare providers and helping them understand how important all of this conversation is to have right when PCNSL is diagnosed. Dawn and Neil, you have your hand up.
The thing is, with lack of information given to us by the doctor, one of the things we were told is don't go to Dr. Google. You know, the Google is about the worst place, and Dawn touched on that earlier. I think when we got onto the lymphoma group on Facebook, it was both discouraging and enlightening to see that we're blessed to be in America, because American treatment is on the forefront of this disease, whereas and Don could speak to it better than I could. You go to Great Britain, and everything's by the book, by the social structure that they've got in Great Britain, where they throw so many treatments at you, and if you haven't cleared up by then, you know, you're on your own. And so I'm glad to be an American, and I'm glad to be in America, where we have choices of treatment, and we have people striving to be just the best and the top in their game. And again, Dawn could speak better than I could. She even found that when we have talked to a friend in Texas that has lymphoma, some of the treatments they were giving her were not the latest and best treatments. And so I think the lesson to take away from that, it would be to one of the doctors said, go to a cancer treatment center that's all they do.
Well, or that the doctor that's the neuro-oncologist has treated, more than a dozen patients, because the less experience they have, unfortunately, that can affect your outcome. I mean, the other thing is the cost. It's prohibitive for a lot of people. I mean, heaven forbid we didn't have insurance at the time. I just can't even imagine. But that there is really no set specific protocol for this cancer yet. It's kind of like the Wild West. You just don't know what treatment you're going to receive. It seems to be based on geography.
Yes. I have a quick question. Were any of you, when you were diagnosed with PCNSL, were you assigned a social worker? So Cassie says yes. Lori, did you say yes?
Yes, yes.
We weren't assigned. I think, I remember they were asking what type of help we thought we needed. And it's like, where do you begin? I mean, it's overwhelming. I think we were offered a chaplain. I remember that, but specifically a social worker, I don't recall.
I'm curious if you all think that would be helpful.
Yeah, yeah.
Is that yes from everybody?
Yeah.
There's a lot of just so you know, I don't employ a social worker only because of the resources, but we do have access to social workers, and we can help you get connected to a social worker if you would like. So you just need to let us know if that's something that you're interested in. We'd be happy to help connect you. That's a resource, and we connect to resources also. So just let us know. Anyway, one of the things I want to do is I've got a couple more questions that people have sent in. Oh, yes. Okay. Yes. But what I want to do is, Sean, can you pop up slide number 13, please? And the reason I want to go to slide 13 is patients, and then we'll wrap up this section. But patients said, what other information do you wish you had received? This was in the survey. Anticipatory experiences, like what to expect. We did talk about that. I didn't get in-depth information on my condition. Okay. I would have liked more detailed information on treatment options and caregiving support. I would have loved to be provided more information on PCNSL. I felt like the information about treatments was not really relevant to me. I joined a support group with other PCNSL patients, and that was very informative. An example of information is a list of specialists who are treating this rare disease in the United States. So those are just really important things and information that people had shared with us that I wanted to share with all of you. So let's go to where we're going to talk about your trusted sources of information. And that is going to be, oh, wait, no, let's not do that yet. Let's go to slide 17. So this is a question that was posed to patients and care partners. Beyond the information that was provided to you by the healthcare provider, where did you go to get additional information when you were originally diagnosed with PCNSL? And so the top graph shows what patients said in the survey, and the bottom graph shows what care partners said in the survey. Thank you, Jamie. We'll connect later. Thank you. So patients said where they went to get other additional information. 24.2% says social media. 30.3% says Google web searching. 18.2% said medical journals. And 6.1% said friends. And 18.2 said patient advocacy groups. Are there any other places you can think of where you would go get information? Or is there any comment from patients on what this slide and that survey was telling us?
How about the Leukemia and Lymphoma Society?
Lori,
Leukemia
say
and
that again
Lymphoma
louder.
Society. They're very good.
Oh, good.
They're
Great. Fantastic. That's good to know. Thank you. So they're a great resource for PCNSL. Okay. Anyone else from a patient perspective have any thoughts?
I just found it interesting that Lori said this, that they were helpful, because when I was in 2013, I didn't find them very helpful. So I'm curious if there's been like some changes, because I remember going to their website and not finding very much about CNS lymphoma. It was very minimal. That I had to look other places.
If you call them on their phone, you can get on their website or whatever, their brochure, and they'll mail you out that. Not just that, they do financial assistance programs too.
That's fantastic. So, Lori, are you saying they have a brochure that is specific to PCNSL?
Right, specific for lymphoma. Leukemia too, but lymphoma as well.
Okay, thank you.
Not specific for PCNSL.
Okay. Okay.
Yeah.
Okay. Thank you. It sounds like that's an unmet need. Okay. Gotcha. So Care Partners said, beyond the information that was provided to you from your healthcare partner, this is where they found additional helpful information. And it's pretty similar to what patients said, really. Patient advocacy groups, 18.4%. Social media, 28.9%. Friends, 7.9%. Google, 32.6%. Medical journals went down just a little bit to 13.2%. Is there any other comments you would like to make if you're a care partner? Leah has her hand up. Leah?
I was actually saying that I personally got a couple of information from social media. It was actually very helpful, most especially Instagram. When I started initially, it was really difficult, and I was trying to be ahead of my game, trying to understand the peculiarities of the illness myself, because I was not given enough information from the healthcare sector. So I had to go online to check people's story, check what people have said about it, how they deal with it. And it was very helpful, because I think I met 2 other people that was in the same state and in the same city with me that had something peculiar to me, and we're able to meet up for coffee and talk a little in depth physically, and it was really lovely. So I would say social media really helps, because from every little post and every little story shared, someone has a hidden message for people.
Thank you. Thank you. Anyone else? So Leah, your hand is still up. And Dawn and Neil.
Everything was in there, actually.
Dawn and Neil, did you have your hand up still?
Yeah.
Dawn, yes.
So what I wanted to say is that, kind of like Cassie said, once you learn the vocabulary, then it's not so bad on the internet, because you can really refine your search and include some of those vocabularies. And that's when you find a lot of medical papers. But I also discovered that you really need to put a date in there as well, so that it will refine and bring up more recent medical papers. You get lost in the weeds because there's still, even within there, a lot of stuff you don't understand. But from the latest research that I've read, even though I don't understand everything that I'm reading, it's very hopeful. So, that in itself, and I know there are people within the Facebook group that go out of their way to find these research papers and post them in the group, so that you can see what the latest research is, what the latest drugs are. And there really is a lot of research going on out there that
There is.
we wouldn't know about otherwise. And that so for those who are able to have a stem cell transplant and who are able to stay in remission longer, that's really hopeful, because with all this cutting edge research, if there is a relapse in the future, there'll be more tools in the toolbox. That's how I look at it.
Thank you, Dawn, for sharing that. So 2 things. We do have a patient navigator and clinical trial coordinator on staff. So if you ever need some information or you're looking for a specific medical journal and you can't access it or something like that, or you're wondering whatever you're wondering, I want you to reach out to us, okay? The other thing that I was going to say, and my professional colleagues might not agree, but that doesn't matter. Don't be afraid of reading medical journals. So you might look at them and go, oh my goodness, I really don't want to read that. I'm sure I'm not going to understand it, all of that kind of thing. Read the very first paragraph and read the conclusion paragraph at the end. And that's pretty much all you need. And then if you have any questions about it at all, get a hold of us and we'll help you with it. Just because there's a lot of information in there and some people are just, what's the right word? They don't want to read all of that technical information. But usually you can grasp what's going on in that medical journal paper by reading the very first paragraph and reading the concluding paragraph. So I just wanted to share that just because it's a helpful way to read medical journals. When you're really a layman at all of this. So
I was talking about.
I think I'm going to utilize this way of reading, the way you explained it, the way of reading it. It's very helpful.
And then the thing is if you have more questions after that, you literally can go in and do the deeper dive. But you can learn so very, very much just from reading the first, why the research was done and what they were trying to determine or trying to prove, and then the conclusion of it. So it's awesome. So let's go forward. Let's look at slide 18. Slide 18 says, is there a source you trust more than others? And that was asked to PCNSL patients, but it was also asked of PCNSL care partners. And there are some slight differences in the percentages. Patients said, is there a source you trust more than others? Patients said patient advocacy groups at 20%. Then they said social media at 10%. They said web search Google at 20%. Medical journals at 55.0%. That's a very high. In your chat, you guys, if you can remember which medical journal that you read some information in that you thought was extremely helpful and that you trust, can you throw that in the chat box for us, please? If you're a patient and if you're a care partner, that'd be great. On the care partner side, they felt that a trusted source was Friends at 16.7%, social media at 25%, medical journals at 16.7%. Okay, that's a big difference between what the patient said over here and what the care partner said as far as trusted sources. And then the care partner said, we trust patient advocacy groups at 41.7%. So that's pretty interesting. Are there any comments or questions or thoughts on there, or did we sort of forget another source that you are trusting? I don't see anything. Okay, let's go to slide 19. We can do a little bit of a deeper dive on that slide. This is for patients. Related to social media, specifically, this was the response. The sources had people who were also in treatment. Okay, so from social media, it wasn't just somebody saying something or a care partner saying something. It was a patient that was saying something. Full journals. I think it is a reliable source of information. Patient advocacy groups. I trust patient advocacy groups more because they provide information based on real patient experiences and are focused on supporting individuals with similar conditions. I'm not going to read the entire list for you, but does anyone have a comment on any of those items that people actually wrote in on the survey. This is the top answers that were written in on the surveys. Don has a question or a comment, or Neil.
Yeah, I'd like, Dawn can relate this better than I can, but she got a call from one of the advocates from Italy. And,
That's a
and,
great story.
and that is a
Yes.
good story. So I'll let Dawn explain that. There you go, Dawn.
So within the first week that I was in the Facebook group and sharing our story, one of the care partners who was on vacation with her husband in Italy, they're from the US, but he was undergoing treatment. She was persistent reaching out to me, kept sending me direct messages. And I'm like, who is this person? But I eventually responded, and she just provided a whole bunch of information and was so full of hope and so encouraging, and just saying, just do it. You just need to, because she knew how frightened I was, because that's the initial thing for a lot of caregivers is you're totally overwhelmed and you don't know where to go and where to turn and who to talk to. And she just kept saying, you can do this. You can do this, and I really needed to hear that, and just the fact that she reached out from the other side of the world was amazing to me.
And her husband was being treated in New York. And when she found out that we were heading to New York, she kind of kicked open a door and made an introduction for us to the doctor that was treating her husband that was going to be treating me. So we had kind of an informal introduction all around by this advocate that we didn't even know.
And
We'd never even met.
it was really cool because I think it was maybe Neil's third treatment that our paths crossed at the hospital and we were able to meet in person.
Wow, that's
Yeah.
cool.
Yeah.
Okay, so that's an amazing advocate. That's a gift. Yes. Thank you for sharing. Does anyone else have any last thoughts and comments on this topic? I don't see. Oh, Cassie, yes.
I was just saying, from my observation and my thoughts, I just feel like as the patient, I just wanted facts. So I feel like the medical journal was way more important. I just want the facts. I want to know what's going to happen. And I know my husband, he was more like anything on Google, like whatever. But for me, I'm like, I just want specific what to expect. I don't want the fluff. I just want to know. And like I did create a social media page, but it's really because I want us to have facts, because I like the community idea of it. And I know social media or like medical journals aren't, a community, but they give us information to be wiser. I don't know if other patients are that way, but I just want facts.
And your point is, we all learn differently, right? We all absorb information differently, and so, yeah, you want just the facts, ma'am. And, and you get that from medical journals, correct? Okay. Yeah. Yeah. And some of us learn through voice. Some of us learn through, social media and Google. Some of us learn through just different talking to other people and, that kind of thing. So thank you. Okay. So let's move to slide number 22, please. So Tim says, I would not recommend research or Google because mostly I came across discouraging information. I prefer support groups and social media where you can meet other patients and caregivers. Thank you, Tim, for sharing. Thank you. So one of the questions that was also asked in the survey to both patients and care partners is, how do you prefer to access resources and information about PCNSL? So we've covered a little bit about this. And here we are. You can see patients said we prefer to access information through support groups. So either in person or online. That's what patients said. And care partners actually said we prefer support groups either in person and or online at 8.3%. So that's really, really interesting, right? At least I find that interesting. Patients said we like physical print copies mailed to us at 20%. And Care Partners said related to physical print copies mailed 16.7%. Something that I'm noticing here is between patients and Care Partners is there's no over the phone or text for patients. I know that we spend an amazing amount of time on the phone and texting and emailing patients and Care Partners ourselves, but I see that patients, we're going to double check that just to make sure that we didn't miss something on the patient side on that. And then it looks like patients like to get their information on PCNSL online at 60%, and Care Partners are saying 66.7% online. And yes, and I do know that I'm looking at the time, and I do know if you have to go, I understand completely. So thank you. So what do you guys think about that? We've been kind of talking about this topic, but is there anything else you want to share before we move on to another topic? No? Are we good? This was an interesting question, slide number 23. And it's about, do you have a care partner or a support person in your community? And patients, 80% of patients said yes, which is fantastic. And 20% said no. And then on the flip side, the same question, care partners said 66.7 is a yes, and 33.3% said no. So we all know, as important it is as a patient to definitely have a care partner or a support person in your community. But you know what? When you're a care partner, you also need to have a support person that's championing you and helping you. And, you know, even if it's someone you don't know, right? And it's a community support. So just don't forget how important it is to take care of yourself, care partners. It's really, really important. And we can do a deeper dive on that another time. So one of the things, slide 24, that was interesting is for patients, if yes, how do they help you with your therapy or your treatment journey? And so patients said that care partners help them with taking their medications. They help drive them to their appointments, their treatment, their therapy, and they help them with their self-care. And then next slide reflects what Care Partners said. This is really, really, really important slide. So Care Partners said this is how we get support. So the Facebook group we've been talking about is the Central Nervous System, CNSL Lymphoma Facebook group, has provided so much support and guidance. They make sure we never feel alone. One caregiver called me while we were on vacation in Italy. Thank you, Dawn. And now I'm paying it forward by helping other patients and care partners navigate this scary diagnosis. Thank you. In taking care of certain things. So care partners have other care partners that help them take care of certain things. That could be errands, that could be whatever you need, right? I need the lawn mowed. I don't know, whatever it is. Just helps you to not feel alone and gives you support with information and symptoms. We've had a meal train for 3 months and kind people checking in on us. As a care partner, that's a really beautiful thing. You know, food, of course, is important, but people checking in on you to see if you need anything is really, really important. And one of the things as a care partner, sometimes people will ask you what you need, what can I do for you? And you can't think about it at the moment because you know you got a lot on your mind. So take some time as a care partner to jot down things that people can help you with when you have a little moment, so that when that person calls you, emails you, rings you, is at your door knocking, and they say, what can I do to help you? You can quickly just literally pick something from the list. It will help. They have a general knowledge of symptoms and treatments, empathy and information, and they share information and recovery. And we have a social worker and mental health team. That is fantastic. As a caregiver, that is awesome. Immensely. I have learned everything that pertains to my husband's cancer from a care partner or a support person. That's quite enlightening, don't you think?
So I found slide number 26 kind of interesting. Within the survey, we asked the question, well, you know, if you're a patient, would you like to be connected to a care partner if you don't have one? And 66.7% said no. And then 33.3% actually did not answer the question. This is on the patient side. So the same question was asked to care partners. Would you like to be connected to another care partner or support person for PCNSL? And 75% said no, but 25% said yes. So there's still an unmet need out there that our care partners really do want to be connected with another care partner and support. So that's really important to know. And then we wanted to know if patients are able to go to their appointments by themselves. Slide 27 revealed some interesting information. 30% rely on their care partner to take them to their appointments. And 70% were able to drive themselves, which is so awesome, right? And then on the care partner side, currently, is the patient able to go to their appointments by themselves, or do they rely on you or others? So 58.3% said they actually rely on me as the care partner to get them to their appointments. 25% said they were able to go all by themselves to their appointments, and 16.7% said that the patients rely on others, or the care partner relies on others to take their loved one, the PCNSL patient, to their appointments. So that was enlightening. So we talked a little bit earlier about what do you wish your healthcare provider had told you. We have a little bit of time, and I want to know, we talked a little bit about it as well. You know, it seems that PCNSL patients often experience behavioral and cognitive memory and or personality changes. And it's something that's not talked about all that often. And so is that something that you want to talk about, one? And two, is that a resource that you think would be very helpful for this community? And how to talk about it perhaps would be a helpful tool or helpful information, something like that. I just want to open it up just for discussion to see what you guys have to say. Dawn.
I think that goes hand in hand with maybe the social worker.
Yeah. Yeah.
Because it is something that's not really talked about, and maybe not everybody experiences it, or just to varying degrees. So again,
Right.
it's one of those things that's, because it's not talked about, you don't know to expect it. When it does happen, a lot of times, it comes out of the clear blue and you just don't know, did I do something wrong, and you just don't know how to deal with it. So yeah, I think it would go hand in hand with all the other discussions, as it's just another component of this crazy disease that just has so many weird side effects. What one person experiences, another patient may not. And I think there's a lot of, within the disease, there's so many different side effects, and not everybody experiences them. But again, if a social worker or someone is assigned to each patient and care partner, that would be really helpful wherever they're being treated.
Okay. Like a social worker being assigned.
Correct. So social worker or someone who has that sort of experience to kind of talk you through it.
Okay. Okay.
Yeah.
Yeah, no, that makes sense. Yeah, if you're not aware and not expecting it, it would be quite the surprise. And also, how do we handle that as a care partner? How do we best help our loved one and the patient? Yeah. Does anyone else have a comment or question or discussion around that particular comment, question?
I'll add on to that too. I was very surprised by like my behavior change, because I can reflect back, time has gone on, and my husband would be like, I don't remember being that aggressive. Like, I don't remember that being my character. So it's actually been nice, and I use air quotes for that, nice, knowing that it wasn't just me that became it's like a whole different person. And being able to look back now and be like, I can't believe that was me, but it was because there was something, I was sick, and accepting the sickness is part of the behavior change, not who
Oh.
you are.
Yes. Anyone else? So if we could go to slide 29, this is just added as we come to our time at the end of our session. This is just a question I was curious about. And so I had asked some of you this when I was doing our interviews, and I want to open it up right now. So the reason we're doing this roundtable is to learn from you, the patient, right? And to learn from you, the care partner. So we need to learn as patient advocates how we best can serve you. But we also want to know, what is it you wanted to receive from your healthcare partner at the time of diagnosis? So we can advocate for that, or perhaps we can help and provide that information to newly diagnosed PCNSL patients and their care partners. But we also know that this is an opportunity. There's a lot of people in research really trying to help you and really trying to find a really awesome treatment for this disease. So if you were able to speak to what I just call the pharma industry, that's everybody, in research for this disease, what is it you would like them to know?
Oh yeah, I said for me, I would like them to know how we feel. First of all, because I feel like you have to know what we're feeling before you can, actually create a solution for it. Then I would want them to, have, more information about what they're doing. They should tell us, just like, we're talking about what we wish we knew or what we wish the doctors told us. They should also tell us some information, how it's going to be administered, or how the medication is going to be like. Nothing should be omitted as well. They should understand, and they should, it should be effective.
You and I had a conversation earlier, and one of the things that you shared with me, which I thought was really beautiful and should be shared because we've actually talked about it even more today, is you would like industry to focus on improving cognitive function with this disease.
Yes.
Do you mean the treatment for this disease?
Yeah, not only treatment, but in the cognitive side as well, behavior or even speech, focus more on this part too, because these are the symptoms in which we go through. And it's actually not easy to go through this.
Yes. It's not easy at all. You
I
wanted them to focus on oral treatments too, I thought.
Yeah, all treatments. I feel like they should have various, types of, ways this could be administered. So oral or injectable, so that we can have like our, choice in which we can make.
Thank you so much. Neil?
Yes, I think what we've heard today is really good. I think what I'd like to see, everybody who gets that abrupt news is smacked in the face, and the first thing that goes through everybody's mind is, I'm going to die. Or this is terminal. This is awful. This is the end. And I think what we need to do is distill some of the points we heard today. I mean, Lori made a good point about, okay, so if we had a brochure handed to us that said, what do we do now? And it had 10 key points. The point number 1, act immediately. Point number 2, find a social group that knows this inside and out. 3, stay away from Google. find somebody who specializes in this cancer. You know, that those touch points, you know, if it was 1 through 10, and it could be know your treatment options, and then a little underneath that, to Lori's comment, know if it can produce side effects, and so it just gets us a jump off point of where do we go from that horrible news that we received from the doctor.
Thank you. Thank you so much, Neil, for sharing. I can't agree with you more. One of the things that Ben said, and Ben, there you are. Ben, when we talked, we were talking about what do you want industry to know? You said you want them to increase funding for rare cancer research like PCNSL. You wish for expanded access to clinical trials and treatment options and diagnostics. And you said streamline clinical trial enrollment, make it easy to access additional treatment, provide patient and care partner support programs. Ben, did you have anything else you wanted to add to that?
No, not really. That's just all.
Okay, thank you for sharing so much. Thank you. Let's see here. Who else is still on here? Do I have Jerry on here at all? Nope. Okay, so Mason, you're not on here, are you? So Mason said about industry, you wish that industry would do some education around stress, particularly around stress causing speech deficits. You're really interested in drugs to help manage the stress. This is with PCNSL disease. You know, when he feels stress, he goes for a walk or he rests, because if he doesn't, he can't communicate effectively. So he was wishing industry would address the effects of stress on this particular disease as it relates to communication and speech. Oh, he said, when people are diagnosed with this disease, people should start speech therapy immediately when diagnosed. And then he also says he was diagnosed at 14 or 15, and he really would have liked to have had the opportunity to meet other people who were diagnosed in his age group with PCNSL. So he would have liked to have had a connection, a support group, right?
Yeah, I said that, yes. I spoke about having people in your age range, people you could communicate with, people that, you feel like, okay, this person is in the right, should I say, communication level with you. So that's what I spoke about. It's kind of something that they should listen to in terms of like how like groups of people, the same age range, of the same, should I say, this disease, having to be able to communicate and have like similar conversations with each other.
Yes. Hear you. And the comment, section is going, I personally agree with Ben. I agree with Ben too. Yes to age range and similar life experiences. So that is this really, really big unmet need with this patient population. One of the other comments that came forward when asked about, what do you want the pharma industry to know? A comment is, there is a lot of pain with this disease. So they need to make effective treatments. They need to create a lot of awareness about this disease and education. They need to have conferences for patients with PCNSL and their care partners and healthcare providers, doctors and researchers that are specific to PCNSL. That is very interesting. I hadn't heard that before. That was very interesting. I have just a couple more things to share. One person shared as far as what do they wish industry knew, and they said, I wish they knew that every patient is different and every patient responds so differently to drugs and to their situation. Ensure they test their drugs on a diverse patient population. Patients should have a time or an opportunity to come together, like a workshop, and come together to share their stories. Oh, one person volunteered, I'd like to help to create a network of like-minded individuals, patients, and care partners. There's just a lot. People shared a lot with us during this project, and we have a lot of information, and all of it will go forward to help not only you as the PCNSL patient and care partner, but all of those in the future who will also be diagnosed, and all those care partners who will be taking care of those folks. And I hope all of the healthcare partners as well who will be taking care of this patient population. There is something else I wanted to share with you, which is slide 32. Has this information been helpful? Slide 32. And have we not gotten to a topic that you wish we had gotten to? So you can speak it out. Go ahead and feel free. We are recording this session today. And then secondly, what do you think we should do with this information going forward? What do you think we, EBCI, should do with this information going forward?
Yeah, so from my side, I feel like the session has been so helpful to me as a caregiver, and also from different patients, different perspectives, and what I can expect from you, like what you can do with the information. I feel like maybe passing that to the relevant authorities, like maybe companies that come up with the medications, and also the government in different states. So they can put that information, whatever we are talking about today, will be useless. But if they put that into action and they work on it, then it will be helpful. Thank you.
Thank you, Jordan. Or sorry, Tim. Thank you. Will you also put that in the chat? Because I was having just a little bit of a problem hearing you. That's okay. But I know what you said is very, very important. Will you also put that in the chat box, please? Leah, are you back? No. Okay. There's a hand up there. Anyone else want to share verbally? What do you think we should do with this information going forward? Okay. I would like us to pop up slide number 33, please. So although your disease is PCNSL, the End Brain Cancer Initiative is hosting an online patient education, patient and care partner, caregiver, and healthcare provider information webinar on May 16th. The focus will be actually brain tumors and brain cancer. But there are some things to be learned within this session that could be helpful also to PCNSL. So consider registering. It's May 16th. There's a QR code there to help register. Or of course, you can go to our website, endbraincancer.org, and register. Registration is free because of sponsors who support our work and donors who support our work. So thank you. And then we talked a lot about care partners today, which is extremely important. Slide 34, please, reflects that we are having a caregivers self-care series and on August 1. And again, registration is free and it's really for care partners. It's really not for patients, just FYI. And this is meant to give you tools to help you in your caregiving efforts. So feel free to register. There's a little bit of information on our website. This program is still being developed out. Elise just put in the link to register as well. It's in your chat. You can also scan the QR code right on your screen, but it tends to be very, very helpful. We invite in a social worker. We invite in other sources who provide us tools. We do have a care partner, caregivers resource section on our website as well. So please go to that, and hopefully that information is helpful. But we'd love you to join us also on Friday, August 1. So we have just 1 minute left. Is there anyone who would like to add anything as we close out this program? Again, I want to say thank you to our PCNSL industry partner right now is Ono Pharmaceuticals. They're supporting much of our advocacy and education work. And we hope to expand that very, very soon to reach all of you because we know the resources are very short. There's not very many resources for all of you, and there's a very large unmet need. So again, Shreya, SHREYA at endbraincancer.org. Her email is in the chat box. She is our clinical trial coordinator and our patient and resource navigator. She's available to help you with anything that you need. In front of you, you also see my email and my phone number. I'm also available to help in any way I can assist. And we look forward to staying in touch. Again, let Shreya know if you are interested in being connected with everybody that was here today. Let us know yes or let us know no. We need to know both ways so we don't make a mistake. We don't want to introduce you to everybody via email if you don't want to be. But again, we would really like to be able to put you together I know that that would be helpful. So I just want to thank all of you for taking the time, those of you who filled out the survey that we had, and all of you today who were here joining us today. Thank you so much for your insights, your voice, and your willingness to share, because I know it's not easy, but I have to express to you how very, very important it is. And thank you. So with that, we will close out the program today. Are you guys good with that?
I have a quick question for you.
Oh, Lori, yes.
Sure. So how do we go about getting reimbursed for the hour and a half that we spent?
Oh, yes. So I will tell you what I know, and then Shreya will add anything I'm missing, okay?
Yeah.
So those will be coming out in gift card form to most everybody. So we have your mailing address and all of those things. We will be processing all of that next week. There's
Okay.
a couple people who cannot accept gift cards, and we've made different arrangements with our treasurer with them. But the compensation for your participation will actually be processed next week. And we will email each of you to let you know when we're actually physically dispersing those out to all of you. Okay. Thank you. Thank you again for participating, Lori. Thank you.
Thank you.
Yes. I'll be reaching out to all of you just to confirm the mailing addresses that I have on file. And then and then we'll be sending out the gift cards to all of you next week. Yeah.
Thank you.
All right.
Thank you so much.
All right.
Thank you so much. You guys have a great Friday and weekend.
Bye. You too.
All right. Bye-bye. Thank you.